Now, billions of people have been vaccinated against Covid-19. The rapid development of vaccines to fight the coronavirus is a major scientific success story, and that's as the World Health Organization marks World Immunization Week. Although the jabs don't stop the spread of Covid-19, they do help prevent serious illness. But despite their life-saving potential, the availability and uptake of Covid-19 vaccines has varied hugely around the world.
Many studies have determined that vaccines developed to fight COVID-19 saved a huge number of lives worldwide. As the number of approved vaccines has multiplied and recommendations from healthcare authorities have evolved, it's grown increasingly difficult to determine who is protected, when a booster is necessary, and which one makes most sense. Interest in vaccines has also fallen. Throughout much of 2021, over 30 million doses were being administered every single day. At peak times, over 40 million. But recently, that's dropped to just a few 100,000 injections daily. According to the World Health Organization, around 70% of the world's population has received at least one dose of COVID-19 vaccine. Many people have had multiple shots, and over 13 billion doses have been administered globally. But distribution remains unequal. While most of the world now averages 2 administered doses or more per inhabitant, India and Russia are still reporting lower rates, around 1.6 and 1.3 respectively. A few countries in Africa have similar numbers, but rates overall on the continent and a few other places remain stubbornly low. In low-income countries in general, says the WHO, only around 3 out of 10 people on average have received even a single dose of COVID-19 vaccine.
Now, India is currently experiencing a spike in COVID-19 cases. The surge is being driven by a new Omicron subvariant of the virus, which effectively dodges immunity gained from vaccination and previous infections. But public health experts do say that previous immunity is preventing severe infections. DW's Manira Chowdhury reports now from Delhi.
India's clinics and hospitals are crowded again. People are once more queuing up to see a doctor about coughs, breathlessness and fever. This small community clinic in Delhi is seeing between 30 to 40 patients with COVID-like symptoms every day. At present, the sample positivity rate in the city is hovering between 25 to 32%. Scientists point to a subvariant of the Omicron COVID variant called XBB 1.16 as the culprit behind the new spate of infections.
This is not a very severe variant. It's not causing the kind of infection in which the patient may face respiratory distress or needs intensive care with oxygen support. It's mostly mild.
Despite the number of rising cases, most public spaces are still seeing large crowds with no safety protocols being followed. The rising COVID infections have caught the attention of the authorities as well. The Delhi government says that it's on high alert to deal with the spurt in cases and that it is fully prepared to handle any kind of emergency. Dr. Sandeep Goyal, a public health expert, says that the latest variant is highly infectious and people should follow basic precautions and accept that the virus is here to stay.
The knowledge, although extensive, is again limited by the fact that mutations are very hard to predict. We go by the historical data, historical illnesses which we have seen for the past 100, 150 years. That data is available. It's likely to be less and less severe with time, and these spurts and these sublineages or some variants can keep on coming.
The country so far has seen 3 big waves of coronavirus. According to the government, in 2022, 90% of India's adult population had been fully vaccinated against COVID. But the numbers are still lagging when it comes to booster shots. Health experts warn that India cannot afford to let its guard down. The traumatic consequences of an unchecked pandemic are still fresh here.
And joining me now is Dr. Lancelot Pinto, a consultant pulmonologist based in Mumbai, India. Dr. Pinto, how important is this World Immunization Week for India? As we've seen there, the coronavirus situation and overall interest in vaccines falling.
Hi, Sarah, and thank you for having me. I think it's important to constantly reiterate the value of vaccination and build on successes. I think it's easy to let your guard down once you notice that a particular disease starts waning. You hear fewer people getting infected or fewer people having severe disease, and you automatically assume that it has gone away. And I think this is true for all diseases. I think the World Immunization Week is a good opportunity for scientific communication to remind people of success stories and remind people of how once upon a time infectious diseases used to be a leading cause of sickness, of hospitalizations and deaths. Life expectancy used to be a lot lower because of infectious diseases, and how a lot of us overcoming these challenges has happened through vaccination. I think it's important to reiterate that it's herd immunity through which immunization works, and nobody is really safe until everybody is safe. So I think it's important, especially for individuals who haven't received their booster shots, individuals who are at high risk of having severe disease, to be reminded that it's extremely important to not rest on the successes that we have achieved so far, but to be constantly vigilant.
How high is the faith in vaccines these days, would you say?
So fortunately, India has had a tradition of being quite open to vaccinations. Our coverages through the universal immunization program has been quite high traditionally, and the vaccine hesitancy that the rest of the world often struggles with has not been so much of a challenge in India, which again is reflected in the fact that we were able to escalate the vaccination coverage reasonably quickly, considering that it is such a large country. And people seem to realize that we've eradicated polio, we've eradicated smallpox. So they do realize that there is a value of immunization, and I think there isn't so much of a hesitancy. That being said, there does appear to be some heterogeneity across the country in vaccination coverages. There does appear to be some disruptions that possibly have been caused by COVID. And I think, therefore, it's important to constantly communicate and remind individuals to make sure that their vaccinations are up to date.
So then, I mean, to your point, we've heard reported that millions of kids missed out on essential childhood vaccinations during the pandemic. How do you then, specifically, how do you as a pulmonologist consult your patients?
So I think COVID in some ways has helped us in terms of the successive waves being milder, and a lot of that being attributed to the success of vaccinations, a lot of that being attributed to hybrid immunity with past infection and vaccination. So I constantly remind my patients that the reason we're having milder waves now is thanks to the fact that a significant proportion of us are now vaccinated. I constantly remind my patients about how childhood pneumonias used to be a leading cause of death, and that has been largely attenuated by the pneumococcal vaccination, which is reasonably well covered in India. So I think it's important as an adult pulmonologist, we have vaccines for pneumonia and influenza, which we are constantly reminding our patients to take.
Thank you so much, Dr. Lancelot Pinto, consultant pulmonologist based in Mumbai. We appreciate it.
Thank you.